welcome to another Top Doctors online interview where we hear expert insight from one of our leading specialists. Today, we're very fortunate to be joined by highly respected cognitive neuropsychologist, Professor Debora Elijah, to speak about ADHD, also known as attention deficit hyperactivity disorder, specifically in adulthood. So welcome, Professor. Thank you very much for joining us today. Would you like to introduce yourself and tell us a little bit about your background or your areas of expertise?
Yes, thank you so much. Thank you for Top Doctors, this great opportunity. I think to be so important for the community, ADHD community on the world. So I'm specialized in disorders, in assessment and intervention plan. So I work with ADHD, ADD, autism spectrum disorder, West syndrome, Williams syndrome, so all the syndromes around, all the neurodivergent world. Let's put in that. I work with the mild form of these disorders, so in diagnosis I can do. We work in a multidisciplinary team here at Elijah Center in UK, in London. We become one of the top centers, and where we deliver intervention from 18 months to 25 years old. So we see all the spectrum in terms of neurodevelopment. Yes, where we having great results. We don't have cure, but great results in terms family, schools or universities, and society. So we work in proceeding intervention, we call social cognitive intervention in peer group. Our interventions are in group, we live in a society, we need to relate, to interact with others and to cooperate with others. Yes.
Thank you so much, Professor. So we're really, really happy to have you with us today. So as we discussed, we're going to be talking about ADHD. Before we start talking about the specifics of ADHD in adulthood, could you just tell us a little bit about ADHD and what that means?
Yes, so attention deficit disorder or attention deficit hyperactivity disorder, ADHD, one with hyperactivity, one not with hyperactivity, but inattention. Yes, it is a neurodevelopmental disorder. What do you mean neurodevelopment disorder? It's a disorder that present in childhood, and you're going to see development in adulthood. What the symptoms you see? Inattention, lack of concentration, impulsivity, deficit in executive function. Yes, and I can explain to you what mean deficit in executive function. Is all little skills I need to do an activity and get results. An example, if I need to bake a lovely cake, I need to know what ingredients I need. I need to put in order. I need to make, okay, I need to open, I need to mix, I need to pour, and then I need to have the time, exactly how long going to take for me to bake that. So I need attention. I need to plan. I need to prioritize. Yes. And also, I need to regulate myself towards. If I don't have these little skills, is under development for people with ADHD. Yes, I not to be able. So we say today ADHD is the disorder of executive functioning, but also dysfunctional in emotional regulation. Because you know what? Some people of individuals, neurodivergent, they need now. They need to know how long going to take. They need to have the gratification straight away. And what's happening in this world, you don't have gratification straight away. You need to work 30 days to have your salary. Yes? Maybe when you play PlayStation, yes, the reward is straight away, so works well. So is empowerment you're going to see in that symptoms along your life. We don't have a cure for ADD or ADHD, so we call pervasive development in that sense. What else we can say? So, in children, it's important to understand we see more the symptoms in hyperactivity by age 5, 8. You can see they don't stop moving from one side to another, climbing here, talking excessively, yes. But the moment they become adult, then we can see some change. So we're going to speak later on also about ADHD come also with some impairments and can develop core disorders, like we're going to speak about anxiety, depression. They have difficulties, they have learning difficulties when it's not addressed in an early stage. We're going to speak a little bit addiction, you know, also using excessive abuse, toxics, drugs, they can be gambling, and so on. So we know people with ADHD going to struggle to sustain attention. Unfortunately, they going to hear the last word, but not the full instruction, because is something keep going with the wired of your brain. So it's not a illness, is how your brain function. This is what we need to say. So we need really to re-educate the brain. You can't teach self-regulation to human being. However, you can help giving strategies. However, have something very interesting. When they really love something, like you can see some people going like fashion, yes, they have this hyper focus, how to do, how to dress, where to buy. They the first one to be able to be the good role modeling for that, in that sense. Uh, we don't know the cause of ADHD. We know he have a very tendency genetic. Yes, we know some parents already, they have the predisposition to have ADHD. So they also have the 25%, let's say like that. It sometimes happen in the period of gestation, so by toxin or infection. So in terms of family irritation, we have 74% you know is genetic, so it's quite high in that sense. Now, how we give the diagnosis? So I'm going very briefly to say today affect for 5 to 7% of children when they diagnosed by the DSM-4, 5 now, he called the Diagnosis Statistic Manual of Mental Disorder, and 1 to 2% we use when we diagnose via IC10 criteria. These have a difference between countries, difference between culture, yes, and in that sense. So we can say we see more ADHD prevalence in boys than girls because we know the female brain is different than male. And later on in life, you're going to see in adulthood, we see now a lot. If you go to the papers, women with ADHD and so on. So become quite, let's say more, we have more awareness about that. We know it's one of the most unpopular disorder, unfortunately. because it's there. You look people, they're beautiful, they're handsome, they're pretty. However, it's so hard because you cannot go through it to them. We know about 30%, 50% they get their diagnosis during adulthood. And they continue to have also later on. Yes.
Thank you, Professor. So you've talked a little bit there about the presentation of ADHD in children.
Yes.
Could you tell us about how the presentation of ADHD changes as people grow up?
Okay, this is a very good question. So we see in children impairments, yes, or deficits, in terms of concentration, in terms of attention. When they're growing, let's say you're going to have more regulation. It's a normal development, childhood, teenage, adult. You have more regulation. So what you see later on, the difference is about hyperactivity. So you have less hyperactivity, but lacking attention. You have problems in working memory, to remember, to encoding, yes, to sustain your attention on the information received right now, because we have a lot of distraction. So it's like I'm talking with you, I see a noise, or I continue to look through the window. I'm not going to pay attention what you asked me. Oh, I forgot what you asked me, what I was saying. So we see a challenge in that more. You can be less, but it's not cured. Yes, and we need to think each individual have their own needs. Yes, going to depend on the environment you are also going to have an effect on you. And what are the new habits you put in your life to control that kind of behavior? So, yes, so usually we replace the restless in adults developing coping skills, like I said before. So the activity become a little bit, I speak with you, but I do like that, or I tap my computer. So you see the restless, but at the same time, they're very good masking to hold themselves when they need, but later on the day, this lashing out. Okay, what else we spoke about? So we can see they copy normal behavior during the adulthood because they're not going to be accepted in terms of social, but it's very hard. Like I said, it's a spectrum, yes. You can have from severe ADHD to moderate ADHD and so on. Also, we're going to see if they have effect in their health, ADHD people in adult, because the stylish of life. So these people, in early stage, they have already a predisposition more for addiction, for obsessive behavior or compulsive behavior because they ongoing. So they replace one behavior to another. This you see more in adulthood. Yes. So we know also they're going to develop psychiatric condition, like I said before, depression or anxiety. So according to a longitudinal study, 60% of children with ADHD still have symptoms as adults. I want to bring to you, Tolsky, ADHD is a chronic in nature, we spoke before, in symptoms may present in different ways as a person moves through life. So even if the symptom diminish, become less, yes. For example, hyperactivity and fidgeting may decrease with the age. Yes.
Thank you, Professor. So to move on to talk about strategies now, I know you've said that ADHD is a highly personal thing. It depends, changes from person to person. What types of strategies can help an adult with ADHD in their general life, at work? What types of things are recommended?
So I think the first thing you need to see your lifestyle. Yes, I think they are amazing people in terms of creativity. They can do multitasks. Yes, if you ask, because I call the popcorn of the brain. So the first thing, create a structure. So I give you a pure example. Some people like to hang their keys behind the door. Yes, for them it's different. Why need to you hang behind the door? So you need to create, they need to create a space, say, look, always I'm going to leave my table and this will be my place. So generalizing little space locating at home or at work where you're going to have your tools to operate. Yes, this is going to give a framework. So visual cues are very important for them to remember, remember the everything working memory, to remember what they're supposed to do, the do list. So you don't need to do a list from 1 to 10, but do a list, a simple, for 3 things you can do in that day. So you break through the task in several segmental in that. So in terms of organization, creating your mobile phone like auditory stimulus. So that time I'm going to have a meeting at 10 minutes before. So reminders, visual auditory reminders going to help in terms of time management. So when we talk about uh, uh, in terms to remind a task, I think first alarms and reminders and colors going to help you. How? So first use alarm before a meeting. Yes, if you need to wake up always the same time, yes, because if they don't do it, the hyperactivity, they have procrastination, they always late. I have always more time to do. So start to do your routine 30 minutes before that. Allow yourself to have more time. Uh, Create a schedule by that day I have meetings. These days I do some working writing, and the other day I review what's supposed to do during the week. So you divide in same tasks, so your brain don't need to be sketchy because it's already sketchy in that sense. Um, I believe very much in physical planner, yes. So it's important. Avoid distractions. So it's important to tell your boss, this is not today. We need to have an engineer environment for ADHD. So say, look, I'm able to do. I don't have any problem to do. However, the way how I'm going to do be different. So sometimes to learn the first time, I need someone to show me exactly what you expect. And I will tell you I can do it in a different way. So how to adapt the environment going towards the needs of the person. So reminders are important, lists are important, schedules are important, and have someone in the work like a co-worker, the end of the week, review what the person did well and what this individual going to need different ways. Some people prefer verbal feedback, and others like written feedback. So you need to create a meeting point for that and build the task for easier to more difficult. So organization. Another thing in terms of organization, you need to create an environment where the person going to understand. So possible, clean possible, the table, very tidy, only have your phone there, but a phone is not your personal phone, this will be distraction, work phone, where be reminders, the do list. Yes, and also I always say it's important to have a voice record. You are doing well. I know you can do it. So you can manifest in your brain also that story going to come ahead. I know I can do it. Will be because they can be quite anxious. They know they're able, but it's the disorder, the performance in that sense. Um, I think. In terms of distraction, always ask a colleague, do I speak excessively? Do I know you? Yes, have a little checklist where sometimes they don't have that kind of filter because they speak a lot and don't give time for others. So socially, or socially they avoid, some people going to avoid to interact and others going to be in the face. So it's important them to show this is the way how we navigate here in our workplace.
Thank you, Professor, for those recommendations. Really interesting. Could we talk now specifically? You've mentioned that some other conditions can co-occur with ADHD. Could you tell us a bit about anxiety and ADHD and why those conditions often go together?
Okay, this is a very important question because we need to create a very good understanding in terms of anxiety and ADHD and both together. So anxiety is all about a disorder of fear, yes? What I cannot control myself. So can be affect cognitive levels, emotional level, physical level, yes. And when I have this kind of fear or dysregulation, let's put, you're going to avoid social situations or you're going to feel more procrastinate because you don't want to face or because you don't have the right tools or the mental state for to face this kind of situation or make the right decision. When you have ADHD, you have the disorder, you forgot to do things. Yes, you can go for to do a test, an exam at university, but you don't remember what you need to write. Or you start on the question 2 and you jump to the question 6 because you skip so many because you can't concentrate. So what's happening at that moment? You receive feedback quite negative. You don't know, but I studied 3 days, but I cannot remember. I have this kind of foggy, mental foggy. So you start to be more anxious when you have these situations. And then when the anxiety comes to ADHD, so you have already the symptoms of forget, you have the symptoms not to remember, yes. So you have difficulty in a relationship with your partner or your husband, and you cannot deal with situations. So you become more anxious, you become more fear. So we need to be really careful because sometimes people receive the diagnosis of anxiety, but they didn't receive the diagnosis, it was ADHD. And when the both combine together, yes, become really a difficult life for these people because you have certain performance you're daily in that life, you cannot do it. Why? You have already situations your life you cannot solving because you cannot perform. You have a deficit. It's the same you ask someone, sorry to say this example, he does have a disability or disabled to jump, but he cannot jump because he doesn't have legs. It's the same when you say for someone in ADHD. Look what you did here. You good talker, however, you didn't perform. So then the panic, I cannot do it, I'm not going to do. So you go to a cycle where a lot of them going to develop depression. And we know that 50% of ADHD adults have anxiety. So we know he starts appear by 8 years old or later teenager, but this need to be addressed with medication, with cognitive behavior therapy. And like I said, it's important to have a mentor with them. So we know that ADHD adult, they're going to have problems in relationship, yes, in regulation in terms of intimacy. Some of them going to have drug abuse, gambling, addiction, because come with oppositional and conduct disorder cannot was treated in the beginning. So ADHD always is plus, unfortunately. In that sense, I hope I give you some idea more about ADHD and anxiety.
Yes, thank you, Professor. I think that's not very well known amongst the general public that it so often goes together. So that's really, really interesting. So just to go on to our final question, you've talked a little bit about diagnosis. How important is it to have a diagnosis of ADHD early on in life?
Look, in life, everything what you prevent, you get in the future better. So why it's important to get this diagnosis? Like I said before, ADHD never come along. Going to come always with a price plus, plus, plus. We don't know the severity of this individual in terms of ADHD. And also, when you have ADHD, you can be under the spectrum of autism. So it's very important for early age to have an assessment, a multidisciplinary assessment, speech language, educational, behavioral, to make a plan for this person. How can this individual first to be keeping the system? Some of these children cannot was assessed, they ending in a young offender. Yes, they not learning, or they expel, or they go to prom. So we to skip all that with a realistic individual plan, assess the beginning, you're going to have certain strategy in the school, how this child can cope at school and assess the curriculum. At home, how these parents need to deal with this child, because it's not easy for the parents. They always also tired because they are in a goal. So they need a lot of strategy in terms of behavioral. They need to learn what's safe, not safe. So having a plan, and also some of these children going to need pharmacology, certain medicine, because what worked for them? Intervention and medicine, not in isolation. You need to combine both in some case. So this is going to prevent these children kids out of the system, children gambling, young offenders, conduct disorders, oppositional, and learning difficulties. You can, today we have the right to plan our lives, our well-being, and to be functioning in the society, because these people can give so much for us.
Thank you so much, Professor Elijah, for joining us today and sharing your really detailed insight on ADHD and adulthood. It's been extremely interesting and I'm sure very beneficial for our audience, so thank you very much. I'd just like to remind anybody listening who thinks they might be affected by ADHD or anyone who's looking to improve how they manage their condition that you can schedule a consultation with Professor Elijah by visiting her Top Doctors profile. You can find us at www.topdoctors.co.uk. Thanks again, Professor Elijah.
Thank you so much. I really appreciate for this time.
Thank you.